Good morning, my dear friends. And amongst this, the COVID era, when probably all of us are relatively free and relatively busy also, nobody knows what to do and nobody is aware what is the future plan or what is the future hold in for everybody. Let us discuss a very important issue for all the hospitals, for all the small nursing homes, or any corporate hospital when we should start surgical systems, when we should start all the invasive procedures in the hospital. And we all know that the basic revenue generating branches or basic revenue generating areas in any hospital, whether it is a corporate hospital or a small 50 bedded hospital, it is always the surgical branches which always generates a lot of revenue. So everybody is eager. Okay, we want to start these surgical programs now in the post COVID era or in the COVID pandemic. Right now, there is a lock in period, but yes, obviously, once the lock in period is over, more and more people will be and more patients will be turning to the hospitals, and then you will have to start operating the patients. At that point of time, what should be your protocols? What should be your safeguarding point so that you, your staff, your medical doctors, and the hospital is safe? Along with that, the patient safety is also ensured that they are not getting infection, COVID infection also. So probably everybody knows now everything about COVID. Everybody is aware of a lot of COVID things because a lot of things are bombarded on WhatsApp and emails and everything. They are now obvious and all around us. So we have to move forward. But unfortunately, nobody has the complete answer. What we should do, when we should do. And that unfortunately, because this scenario is such that people are not aware of the protocols and how to deal with this pandemic situation. There are no pre-existing off-the-shelf answers right now. And there are myriads of problems which are popping up, which are coming up, and you have to solve day in and day out. My only answer to this is it is a process. You have to follow the processes which probably you may have to change day in and day out. What I have learned in this COVID era is one thing everybody will have to learn, unlearn, and relearn the things. It is not that one thing which is on the board is full and final. We call it as patthar ki lakir. It is not that. It is a very dynamic situation, and everybody will have to change the things again and again. In CIMS itself, I would say what the surgical protocols that we have made, we have now 3 additions within a period of just 2 months by addition and deletion of the things which pop up according to the government rules and regulation. Very important thing, the issue highlighted in this review should not be taken as official guidelines, mandates, or operating procedures because things change. Probably what I am talking today may change in another 8 days or so. So these are the basically few guidelines, or I would say a platform on which you can update, you can improvise based on your availability of the resources, your availability of the human resources, and based on that you can change and adapt the things. So in unprecedented situations, everything we are doing is an experiment in the real time. So I would say the protocol that we have devised, it has been devised based on communication, and that to a frequent communication between lot of people around, and all people were involved, right from surgeon, intensivist, care units, anesthesia people, nursing staff, respiratory therapists, ID specialist, and microbiologist. So we all have been brainstorming the things. We have come out with the protocols, and based on that, what I'm going to share with you, which will be applicable and which will be fruitful for you all people. Very important thing to start this discussion is self-discipline will be the key thing. If we all are self-disciplined and we all agree to that self-disciplined way of living, then and then only we will be able to sail through this pandemic. Particularly the staff and the doctors, they need to understand that if they are coming from the hotspot areas, then try not to come to the hospital until unless that area is really clear of pandemic. If you are having fever, if you are having cold, cough, or temperature, just inform to your colleagues and don't come to the hospital for at least 7 to 14 days, or else you get yourself investigated for COVID. And if it's COVID is negative, then yes, after a rest of few days you can join. But if the COVID is positive, make yourself quarantine for at least 14 days. In our practice also, what we have done is we have identified fixed number of staffs in each OT, so that only that staff comes here. They are from an area which are not red hot zone areas, and that staff is educated very, very well about the processes, about the PPEs, about the whole things, so that there is zero error in whenever we perform the surgeries. So this is how we have done, and we have created a self-disciplined team inside the hospital. Moving forward, what are the key considerations for the surgeons and his team? Obviously, the patient care and the staff safety is of paramount importance. And as a healthcare workers, we are at the most high risk category of patients who can get exposed and get infected. What the data has shown that almost 10 to 15% cases are healthcare workers who are infected, and also the healthcare workers who are spreading the disease also. And why this is occurring, and particularly the surgeons are the most exposed person, because viral particles are essentially present everywhere, from the nasal swabs, from the pharyngeal swab, sputum, bronchial thing, secretions, gastrointestinal tissues, blood, and stool. This all contains viral particles, and this is where the surgeons are always going to get involved, and this is where the aerosol dissemination can occur. Virus can spread via aerosols, fomites, and even the surgical smoke. We normally think if we are using the electrocautery, the viruses will get destroyed or will get dead. It is not so. Even the smoke also has the viral particles, so we have to keep that in mind. And very key thing to be kept in mind when you start your surgical program is there is an acute shortages of PPE. So judicious use, adequate knowledge about the PPEs is important when you start the things as a surgical program there. What is the effective PPE against the aerosol spread? We all know that any surgical procedure, whether we are doing a laparoscopic surgery or whether we are using SAW or high-speed instruments in the OT, in the OR, lot of smoke and lot of aerosols are generated, which spreads into a positive pressure area and then can spread very fast amongst the people who are operating in the operation theaters. So practically all surgical procedures, except few surgical procedures which I'm going to enumerate, they all are aerosol generating procedures. So adequate knowledge and education about the disease transmission and use of prevention gear and infection control protocols are essential to prevent the spread of infection among healthcare workers. Normally, level 2 and level 3 PPs are used in all the OTs, which have to be kept in mind. And this is the PP protocols that we have made for CIMS hospital. And this is what we normally use. You can take the picture and you can use it in your own clinics also. Another very important thing, if you can see in the lower part, that what I have enumerated, that we have fixed the staff in GOT, CTOT, cath lab, and endoscopy. Only that staff will be wearing the PPs, that staff will be doing the surgeries, getting involved in the surgeries, so that you don't have to repeat the things with different staff, and the PP utilization is minimized. Because of acute shortage of PPs, there are a lot of SOPs coming out, and N95 mask is the main things which have to be used. And all surgeons, all the person who are working in the OT, N95 mask is compulsory. And what we have made is we have made it a protocol for reusing the N95 mask, and it has been approved by All India Institute and CDC of USA also. We give 4 N95 masks to all the people in the OT, working in the OT. First day N95 mask can be used on 5th day, and in between that mask is to be kept in the paper bag so that it gets dried off and you can use it later on. Very important thing to be kept in mind is, and the most effective way to prevent viral exposure is to avoid performing non-essential surgical procedures in the coming time. So there are obviously some procedures like life-saving procedures or limb-saving procedures which you need to do in emergency basis, and you have to go in for surgeries with adequate protections and the protocols that you establish for the surgeries. But lifestyle surgeries like knee replacement surgeries, or you have the hip replacement surgeries or cosmetic surgeries or surgeries which are not life-threatening, they can be postponed for another 2-3 months. That is the wise thing, so that you can use optimal utilization of the human resource, optimal utilization of the other resources which are required for the OTs can be done. You can adapt surgical techniques to reduce the exposure risk also. You can change the techniques. It is said that laparoscopic surgeries, it is one of the surgery wherein there is significant aerosol dissemination of the viruses. So if required and if possible, change the surgical plan from laparoscopic surgery to the open surgeries, from small cuts, and also you can do the laparotomy surgery for appendicectomy or cholecystectomy procedures. If the patient is having appendicitis, try to manage the patient conservative way. If the conservative way is not fruitful, then go for the open surgery. Same ways with the cholecystitis. Most common question occurs always in the cancer surgery: how long you can delay the surgeries. So there you can discuss with your chemo people, you can discuss with the radio people, radiotherapy people, and if you can add neoadjuvant chemotherapy or radiotherapies and delay the surgical procedure, that is how you can delay the surgeries. But if required and there is no other option, you can go ahead with the surgeries even in the onco surgeries. What we have done is we have bifurcated the surgeries according to high risk, moderate risk, and low risk surgeries. High risk surgeries are cardiac and thoracic surgeries, surgeries involving prosthesis, endoscopy, bronchoscopy, laparoscopic procedures, colonoscopy, ECMO procedure, organ transplantation, ENT surgeries, oral surgeries, polytrauma surgeries, DLB scopies, intubations, and ortho surgeries. These are high risk surgeries because there is significant chances of dissemination of the aerosols in the OR area. There are moderate risk surgeries like debridement, like central line insertion procedures, neurosurgeries, gynec procedures. These are the surgeries which come into moderate risk. And low risk surgeries are bone marrow aspiration, pain management, circumcisions, INDs, ICRT, DNC, DE, vascular surgery, and chemo port insertions. So the people who require low risk surgeries, I think so you can safely go in with the surgeries at your own clinic or your hospital without much issues. You can perform that surgeries safely with routine your protocols and routine PP utilization. But if the patient falls into the high risk category of patients or moderate risk, then you have to be very careful and you have to follow the protocols that we are going to discuss. So triage of the patient starts from the OPD. And what we have done is all patients, when they get admitted in the hospital for the surgery, they go through the flu corner or the fever clinic OPDs. They are screened there. And based on that screening, we always divide that patient into high risk, low risk, and moderate risk patients. Second very important thing, before the patient enters into the ward or the hospital, every patient is given a mask. Patient and the patient relative should be wearing mask, is compulsory. CIMS admission triage, these are the 5 questions we ask each and every patient. And based on that, that is the age, symptoms of fever, cough, cold, breathlessness, diarrhea, comorbidities like diabetes mellitus, hypertension, COPD, heart disease, and history of COVID. Patients in their area, that is the hotspot areas, if they are from that area, then they definitely fall into moderate risk. And history of contact with COVID-19 patients, they are all high risk category of patients. So based on that, we bifurcate the patients in 3 categories, and then based on that, we follow the whole protocols. These are the red zones which should be always displayed in your flu corner and in your hospitals, so that the people, they come to know whether this patient who is admitted is from the red zone or not, and then we have to be really careful. These are the few protocols wherein the patient who is of moderate risk or high risk, we admit in an isolation ward, and this all things are followed, so that when you do an COVID test and do further tests, those dissemination of disease progression may not be there, and everybody is safe in the hospital. So these are the protocols that we follow in isolation ward. Before venturing for the surgery, any surgery, this is mandatory and should be there in all consent now. Consent for undergoing treatment during the COVID-19 pandemic. It is very important, and get it signed by all the patients. Once in the OT, you have to assume that everything will be contaminated. You have to assume all patients are contaminated. So negative pressure OT, if possible, designate that OT as a negative pressure OT. If it is not there, then definitely you can increase the cycle of the air cycles also. Between two cases, keep significant time for the cleaning and disinfecting of the OTs. Once the OT starts, limit the number of persons and paperwork and everything inside the OT. Disposable items to be used. There has to be a separate area designated for removing all the gowns, gloves, and shoe covers after the surgery is over, which has to be discarded immediately outside the hospital, or they are to be burnt out. Doffing and donning system, or the process of wearing the protective PPEs, is very important, and we have devised a system over here called the buddy system, wherein when I'm donning the PPEs, the person standing there will correct me and will tell me this step is wrong and you have to do this. So that is how you learn things which are absolutely new for your environment. This thing you can paste it inside your OTs to tell them this is donning method and this is doffing method, so that everybody goes through that every day and you can memorize it in a couple of days only. Anesthesia, obviously there are strict protocols which I'm not going to go into detail, but yes, there are protocols for extubation, protocols for intubation in the OT. All equipments which are in the anesthesia area have to be covered with a plastic covering, so that after the surgery you can clean each and every instrument with the disinfectant nicely. So that is very mandatory. Surface cleaning of all the medical devices is mandatory after each and every case, and if possible you can fumigate the OT also. Post-surgical care, when you go to see the patient in the ward who are low risk or moderate risk, PP level 1 is good enough. But if they are high risk category of patients, then definitely you need to wear PP level 2 PPs is important. If you are operating COVID-19 patient, positive patients, then two things to be kept in mind. One is they are very likely to have deep vein thrombosis, and second thing is very likely to have pulmonary secondary infections. So be watchful in that patients. Endoscopy procedures, yes, as far as possible, defer all planned procedures, because this comes into high risk category of patients. But yes, if you need to do it, this is what the suit you should be wearing. It is level 3 PP, and this is Dr. Bhavesh Thakur who performed these procedures just 2 days back in our own hospital. So this is how the whole procedure is carried out into a closed negative pressure room that we have created in the OT. Another thing for the cost cutting of PP, what you can do is you can plan 3-4 procedures at a time, use that same single PP for 3-4 procedures, so that the cost is less and judicious use of PPs can be done. At this point of time, nobody is going to deal with COVID-19 positive patients for the surgery. But times may come when you may have to operate for emergency procedures. Then this is the whole flow chart for this, and you can follow this flow chart. Very important point, and the crux of this is level 3 PPs should be worn by all the patients who are handling COVID-19 positive patients. That is by compulsion. This is the protocol that we have done. It is a very busy slide, but what you can do is you can click this photograph and you can then go through it. Whatever I have discussed right now, the same thing is there. Right from admission, you bifurcate the patients into low risk, moderate risk, and high risk. If the patient is low risk, with the low risk surgery, you can straight away admit the patient and do the surgery. If it is a moderate risk patient, get an CBC and X-ray done in the ER. If there is any doubt, or even if the low risk, moderate risk patient is there with high risk surgery, admit that patient into isolation ward, get COVID test done, and once the COVID test is negative, then you can proceed for the routine surgery. And if the patient is high risk surgery, yes, at this point of time, we are not operating that patients, but yes, we are talking with the AMC, and then we discuss what should be the plan of action, whether to send that patient to the government hospital for the surgery, or we can do it here. And as this is the US guideline recently published, it is priority one thing, priority one. All hospitalized patients should be screened for COVID now. Unfortunately, in India, not all states are doing this. There are states like Maharashtra, Delhi, Tamil Nadu, they wherein all patients can get COVID tests, but in certain states it's still not possible. But this should be mandatory for the safety and efficacy for the, I would say, the surgeon, the staff, and the paramedical staff. This is how we have done the surgery recently, bypass surgeries. This is level 3 PP worn by the anesthetist, level 2 worn by me for the surgical procedures. This is how intubation is done under the cover of the plastic cover. And this is how you cover all the instruments, all the monitors inside the OT with the plastic so that they can be cleaned easily after the surgery is done. A very important scenarios may come across in your day-to-day practice is in an emergency, you don't have the time for checking for COVID test. Then what? Same thing is yesterday happened with us. Yesterday, Dr. Bala Ganpati had a patient with hemorrhage and need to do emergency craniotomy. So what we did is we did took the swab in the ER. Immediately the patient was shifted in the OT because you cannot wait for the COVID test for 8-10 hours. And with this level 3 PPs, you can perform the surgery. After the surgery, patient is shifted to the isolation ward. And once the COVID test comes negative, then the patient can be shifted to routine ICU or the ward. So this is how the whole protocol can be maintained if the patient is coming from hotspot area wherein the likelihood of COVID is very high. So this is all protocols that we have made are based on the references that we have seen. We have studied a lot of articles. We have gone through a lot of papers, and based on that, we have come out with this whole protocols. So probably this might be of help to everybody. And in your practice, in your OT procedures, in your hospitals, if you follow these protocols, then I'm pretty sure the chances of infection to the doctors, to the staff, and to the paramedical staff would be very minimal. And this is the same protocols which have been implemented in Singapore, in Hong Kong, in South Korea, where these people have the minimum of healthcare worker infection rate. So probably by following this, we will be safeguarding ourselves also, and we will be safeguarding the patients also. So last but not the least, I would say, take care, be safe, keep distance right now. Social distancing is must. Take care of yourself, because you and everybody of us medical professionals are very important for the society. If we are fit, we are safe, we will be able to serve the nation, we will be able to serve the society, the state, and the country. Last but not the least, keep this in mind. This is not the sprint. This pandemic is going to be a marathon pandemic. It is going to last for another 5, 6 months, 7 months, and we have to be prepared for all these things. And probably at every point of time, you may have to change the plan. Every time you may have to change the protocols, you may have to modify the protocols to win this race. One thing is very clear. Everybody will have to participate in this marathon. Only thing is, if you want to win this marathon, you have to follow the processes, protocols, and be ready for the onslaught also. Thank you very much.